The COVID-19 pandemic taught us a harsh lesson. We must be better prepared for future health crises. The human cost of the pandemic, millions of lives lost, is immeasurable. The economic fallout, job losses, business closures continues to impact us. We must learn from this experience and commit to a future where we are better equipped to handle pandemics. Pandemics are a threat to everyone, regardless of where they live or their social status. We are all interconnected, and a disease outbreak anywhere can quickly become a global crisis. This is why pandemic preparedness is not just a health issue, it's a global security issue, an economic issue, and a moral imperative. Our ability to prevent and control future pandemics depends on our collective action. We must invest in robust public health systems, strengthen global cooperation, and prioritize scientific research. Only then can we hope to mitigate the impact of future health emergencies and protect the well-being of generations to come. Early detection of disease outbreaks is paramount to preventing pandemics. Just like a fire, the sooner we detect a potential outbreak, the easier it is to contain. We need robust surveillance systems in place globally. These systems should be able to quickly identify unusual disease patterns and trigger a rapid response. This involves investing in laboratory capacity, training healthcare workers, and using technology like artificial intelligence to analyze data and detect outbreaks in real time. Imagine a future where a new virus emerges. Instead of spreading silently for weeks, it's detected within days. This early warning gives us time to activate response plans, isolate cases, trace contacts, and prevent a global health crisis. Once a potential pandemic threat is detected, a swift and coordinated response is crucial. This requires clear lines of communication and collaboration between different levels of government, healthcare institutions, and international organizations. National governments play a critical role in coordinating the response within their borders. They need to have clear plans in place for testing, contact tracing, isolation, and treatment. They also need to be prepared to implement public health measures like travel restrictions and social distancing if necessary. However, pandemics don't respect borders. International cooperation is essential to share information, coordinate travel restrictions, and provide assistance to countries that need it. The World Health Organization, WHO, plays a vital role in coordinating the global response. Section 4. Vaccines. Our shield against future threats. Vaccines have proven to be one of the most effective tools in our fight against infectious diseases. They are crucial for preventing future pandemics. We need to invest in research and development to create new and improved vaccines against known threats and emerging pathogens. Equitable access to vaccines is critical. During the COVID-19 pandemic, we saw how vaccine inequity prolonged the pandemic and cost lives. We must ensure that future vaccines are available and affordable to everyone, regardless of where they live. This requires international collaboration and innovative approaches to vaccine development, manufacturing, and distribution. We need to strengthen global supply chains and ensure that countries have the resources and infrastructure to deliver vaccines to their populations. Section 5. Strengthening our defenses. Public health infrastructure and beyond. The COVID-19 pandemic exposed vulnerabilities in public health systems worldwide. We need to strengthen our public health infrastructure to be better prepared for future challenges. This includes investing in our healthcare workforce. We need more doctors, nurses, epidemiologists, and laboratory technicians. We need to ensure they have the training, resources, and support they need to do their jobs effectively. Public health education is also crucial. We need to empower communities with the knowledge and skills to protect themselves and prevent the spread of disease. This includes promoting health literacy, hygiene practices, and vaccination. Finally, we need to invest in research and innovation. Section 6. Global cooperation, a shared responsibility. Pandemic preparedness is not a one-time effort, but an ongoing process. We need to learn from our experiences, adapt to new threats, and continuously strengthen our defenses. International cooperation is not just an option, it's a necessity. We need to work together, share information, and coordinate our efforts to build a safer and healthier future for everyone. The COVID-19 pandemic was a stark reminder of our interconnectedness and the importance of global solidarity. We must not let this lesson go unheeded. Let's work together to create a world where we are better prepared for future pandemics and where everyone has the opportunity to live a long and healthy life. The time to act is now. The